Heartburn is a common digestive complaint which affects an estimated 60 million Americans every month. Relief of mild heartburn is typically achieved through diet and lifestyle changes, although medication is usually necessary if the heartburn is caused by gastroesophageal reflux disease (GERD). What is heartburn? Heartburn is a digestive problem. It has nothing to do with your heart. It occurs when small amounts of stomach acid accidentally rise up the esophagus, causing symptoms like a burning pain in the chest which rises towards the throat. Sufferers may even taste the fluid in the back of the mouth, and this is called acid indigestion. In many cases the pain and burning sensation is relatively mild, but sometimes is so severe that patients think they are experiencing a heart attack. What are the causes of heartburn? In general, the immediate cause of heartburn is the acidic digestive juices which leave the stomach and rise up the esophagus. The acid burns the tissue of the esophagus, causing inflammation and pain, a condition called esophagitis. Heartburn may also occur in pregnancy when the baby is pressing up against the underside of the diaphragm and squeezing the stomach. Gastroesophageal reflux disease. GERD is characterized by a failure of the muscular valve, known as the lower esophageal sphincter, which is located at the bottom of the esophagus. The function of this valve is to keep acid in the stomach and prevent it leaking back up the esophagus. When this valve doesn't work properly, reflux and heartburn can occur. Factors that contribute to gastroesophageal reflux disease include obesity, pregnancy, smoking and, in particular, hiatal hernia. Dietary treatment for heartburn. In cases of persistent heartburn, dietary improvements are not sufficient. So as well as advocating a digestion-friendly diet, your doctor is likely to recommend one or more of the following types of medication. If overweight, switch to a healthy weight loss diet. Obesity, especially excess fat on the chest and abdomen, is a common contributory factor to GERD and hiatal hernia, and therefore to heartburn. So if you are obese, BMI greater than 30, take steps to normalize your weight and thus reduce your risk or symptoms of heartburn. Choose a healthy calorie-controlled diet and customize it by following the eating tips below. Stop eating large meals. A big meal distends the stomach and causes a rise in the production of stomach acid. So opt for 4 to 6 small meals or snacks, and allow a maximum of 3 hours between eating. Avoid acidic food. Reduce your intake of very acidic foods by avoiding items such as tomatoes, tomato-based sauces, citrus fruits, rhubarb, gooseberries, unripe fruit, vinegar and acidic pickles or relishes. Fried or very fatty foods, including candy, encourage indigestion and should be avoided or eaten sparingly. So go easy on butter, mayo, sausages, salami, hate, meat pies, and full-fat cheese. The same applies to very spicy foods such as black pepper, chili peppers, curry, mustard and other hot spices, as well as raw onions and garlic. Avoid carbonated drinks. Fizzy or carbonated soft drinks cause belching and upward pressure on the lower esophageal sphincter, increasing the likelihood of heartburn. The best drinks include water, herbal teas or diluted non-citrus fruit juices. Eat more fiber, especially soluble fiber. Reduce alcohol consumption. Alcohol is also a source of non-nutritious calories and can contribute to overweight. Lifestyle improvements to reduce heartburn. One obvious one is to stop smoking, as tobacco smoke increases acidity in the stomach. Avoid placing extra strain on your abdomen or chest. Wear loose-fitting clothes, and do not overstretch or lift heavy weights. Do not lie down after eating, and try not to eat anything for at least 3 hours before going to bed. Do not use extra pillows, you simply end up with a stiff neck as well as heartburn.